information asymmetry is killing patients. The traditional stereotype of the clinician as the all-knowing expert, the pedagogue who's dictating treatment terms to their willing and compliant patients, has caused so much actual bodily harm over the years. Take, for example, the opioid crisis in the US. So many clinicians have been blindly prescribing painkillers to their ill-informed patients who are not able to object to some of those prescriptions. Take the management of chronic disease, the number of poorly managed diabetics out there who, in between their doctor's appointments, are floundering. They're not empowered to look after themselves and their diabetes, their blood sugar. And then take the learned dependencies that we as a population have developed, which means we resort to seeing the doctor for every little ailment, every niggle, every ache that we have, and not considering the option to look after that ourselves. Think about the burden on the healthcare system that this is creating. Think about the negative impact on care outcomes that this is resulting in. So what I want to talk to you about today is the turning point in the patient-doctor relationship and how we empower individuals to look after their own health. So think for a minute about what would happen if we were to empower individuals to self-care for common, relatively harmless ailments so they don't need to burden their local GP clinic or local A&E with these things. Think about a diabetic or an asthmatic who is empowered to analyze the data behind their disease and therefore identify deteriorations in their condition early and reduce the risk of ending up in hospital with a complication of their disease. And then think also about an individual with intractable back pain who has researched the 3 or 4 different treatment options and the evidence basis behind each of those treatment options before they go and see their doctor for the first time about the back pain. They, at that point, can have a much more balanced conversation with their clinician about what to do with their back pain. This will improve care outcomes for so many individuals. Hopefully, nearly every one of you will know friends or family in this audience who have taken health matters into their own hands and who do feel empowered to look after themselves. So this revolution is happening. There is a turning point taking place in that patient-doctor relationship. How do we now round the corner and make that a mainstay, a standard practice when a patient goes to see a doctor? And that's what I want us to think about today. So first of all, let me try and make this concept a little bit more real with a couple of tangible examples. So take Alice, 32-year-old mother of 2, who wakes up one morning with stomach pain, wondering whether it could possibly be a urine infection, but really she's not sure. Traditionally, she would have ended up waiting for hours to speak with her GP in either on the phone or in the waiting room, and then waited again to get the results from a urine dipstick test that you may use to test for urine infections, and then waited even longer still for a prescription, if needed, for her urine infection. This will probably have taken her nearly all day, causing a lot of angst and anxiety, but also a real challenge in terms of childcare for Alice. What does she do with her 2 young children at home? Now think about what if Alice was able to pick up her phone and use the automated symptom checker that she had on her phone, enter in her symptoms, and be suggested a course of action. So let's say she puts in her symptoms, she's got some stomach ache, she's got some pain when passing urine, and the automated symptom checker suggests that she might have a urine infection and offers to send a smart urine dipstick test to her home. Alice then does that test at home. is able to send that result to a pharmacist, to a local pharmacist, or an online doctor for an almost immediate review of the test results. And if the test turns out to be positive, she can be sent a prescription for home delivery of the antibiotics that she needs to get better, all while staying at home, and the time to treatment is significantly shortened. So imagine the improvement that has been brought about in care outcomes and the reduction of burden, one less person waiting to see their GP. Urine infections are one of the most common drivers of GP consultations in this country, and technologies and empowering patients in this way can really help to address that issue. Let's take one more example. Meet Ravi, a 63-year-old, recently diagnosed diabetic. Ravi has just returned from an appointment with his doctor where they have been talking about how he should be using his insulin injection pen to treat his diabetes, and also how he should be checking his feet for ulcers, a common complication in diabetes. Ravi gets home and he realizes that all of that information has gone in one ear and out the other. It's an extremely stressful time for Ravi right now with the recent diagnosis. He wasn't able to focus on the consultation. And additionally, it turns out that English is not his first language. And so there was a comprehension issue during the consultation too. Ravi decides that he'll go on YouTube and search for both how to inject insulin and also how to check for foot ulcers, because the one thing he did get from the consultation is that these things are both important to manage his diabetes. Half an hour later, he has a really good understanding of how to make use of his insulin injection pen and how to check his feet for ulcers. And in fact, he found some really good content from the NHS in Gujarati on these topics. And so now Ravi feels so much more empowered and better able to manage his diabetes because we have given him the opportunity to look after his own healthcare, to sort of take on the responsibility of looking after himself. Some of you may hear later, or your friends are going to hear later from another speaker, Lavinia. She puts up a lot of exercise content on YouTube. This is just another example of how you can use the power of information for individuals to reduce their risk of chronic disease. And primary prevention of chronic disease is one of the most valuable things that we can, changes and impacts that we can bring about by empowering patients, by providing them with information. So I want you to think for a minute about the benefits that we can bring to the health system if we empower patients to do more for themselves. Unfortunately, we've seen what's happening with the NHS right now. We are in an unsustainable situation. We have too many people going to see their GP. We have too many people queuing in A&E. They're not even trying to stick to the 4-hour waiting times in A&Es anymore. And having been on the front line, I have seen the number of cases where individuals and their families are coming to see the doctor when it's not necessary. So what are the ingredients to help catalyze this revolution, to bring about this patient power revolution? First and foremost, we need to, as individuals, every single one of us, become active, go from being passive recipients of healthcare to active participants in our own healthcare journey. This is a mindset shift that is not easy, but it is the only way that we can unlock the power that we have to help patients help themselves. Secondly, we need enabling technologies. So I referred previously to the smart urine dipstick. I referred to video sharing platforms like YouTube. There are plenty of other technologies out there. We shouldn't be controlled by the technologies, but we should see them as enabling us to get to a place where healthcare can be delivered in a better and more efficient way. And then thirdly, we need clinicians to both innovate and advocate on the front line. I'm going to elaborate on these 2 points shortly in what is the second turning point that I want to mention. But but the clinicians have a very important role to play in this. And if we're able to put these ingredients together and catalyze this patient power revolution, then it gives us hope for the long-term survival of health systems such as the NHS. So I want to finish now by talking in a bit more detail about the third point, the role of clinicians in all of this. So that has been my work for the last decade, trying to develop patient-facing innovations that can truly improve the patient's experience of healthcare, their ability to help themselves, their ability to impact, change, and influence the outcomes of their own health journeys. And what I've seen over the last decade is a turning point in the way that clinicians are using their time on the front line when they're studying and when they've qualified. Gone are the days when a clinician is merely a service provider being told by the system to see this patient and then see the next patient and another one. And actually, this patient, this fourth patient you're seeing, has been in 10 times this year already with the same problem. The blood sugars keep spiking as soon as they leave the clinic. And instead, what we're seeing is clinicians trying to innovate on the front line, trying to solve the problems that they're seeing that their patients have. And this is helping to develop those enabling technologies that I mentioned before, which will bring about this patient power revolution. So with the advent of movements like Doctorpreneurs, the healthcare innovation community that I've been involved in for the last decade, the proliferation of health innovation societies at universities, at schools, and then also the growth in enabling technologies such as no-code platforms, which allow anyone and everyone to develop their own app, their own prototype, their own software solution to the problems that they're seeing on the clinical front line. Through these different elements, we're seeing that turning point of what it means to be a clinician on the front line. And one thing that, for some of you particularly relevant, because you will go on to become clinicians on the front line in the NHS and other health systems, but then for others of you, whichever field you guys end up in, think about the unique position that you are in on the front line. Let's say you're a lawyer serving clients, you're an accountant serving FTSE 100 companies, you're a clinician serving your patients. You are in a unique position to understand the needs of the clients, of the patients. People talk a lot about trying to solve problems as a means of entrepreneurship. Who better to solve that problem than those who are on the front line, experiencing them day in, day out? And secondly, you, especially as clinicians, are in a unique position to influence the behaviors of your patients. So you may not have developed an innovation yourself, but you may be aware of a few interesting innovations that could empower them to look after their own health condition. And you as a clinician can say to the patient, actually, I think that you should use this app or you should use this device to help you once you leave the clinic today. Because it isn't all about the things that I can do for you. It's about what you can do for yourself. And I am recommending that you use these technologies to help you help yourself. And so as advocates, clinicians have an extremely important role to play. And so I'll finish by saying, for each and every one of us in this room, we need to be part of this patient power revolution. The NHS will not survive in its current form. We need to take control of our healthcare, and we need to access the enabling technologies that will allow us to do that. And that is a message that we should be spreading to all friends and family who are unwell. And then for the clinicians or budding clinicians in the room specifically, I want you guys to think about how you can be more than just service providers on the front line once you do get into that privileged position of serving in the NHS. Think about the problems that you're seeing on the front line. Develop the very innovations that will help to catalyze the patient power revolution. Thank you.